Hi there, and welcome to Cardiophiles. This is episode 1 of our series on conditions and treatments. Today we'll be talking about a condition called atrial fibrillation. Well, what is atrial fibrillation? Atrial fibrillation is one of the most common heart arrhythmias. You will commonly see it referred to as AF or AFib. It's a supraventricular arrhythmia, meaning it originates in the atria and is caused by extra impulses firing from different points in the atria. This causes the heart to twitch or fibrillate. This means that blood is not pumped out effectively as the chambers are not given sufficient time to fill and are not able to contract effectively. It comes in 3 forms: permanent, where the heart never returns to sinus rhythm; persistent, where the fibrillation lasts more than 7 days at a time; or paroxysmal, which is where the atrial fibrillation comes and goes, usually lasting for less than 2 days, but can last up to 7. This causes problems as it increases the risk of blood clots developing in the heart. These clots then travel to the brain, causing a stroke. You are 5 times more likely to have a stroke if you have AF. Also, the effect it has on the heart's performance increases the risk of heart failure in the future. So how do people get AF? It's unknown what the actual cause of it is, but there are many factors that increase the chance of developing AF. The first is due to age. As you get older, the chances of AF increases. About 7% of over 65s have atrial fibrillation. Also, the presence of other conditions, such as coronary heart disease, high blood pressure, an overactive thyroid, lung cancers, chest infections like pneumonia, or alcohol or drug misuse, affects the chances of having AF. There are a few ways in which this can be diagnosed. The first way to detect is just by checking your pulse at your wrist. The pulse will feel irregular and the beats may occur at varying strengths. If your GP suspects you have AFib, they'll refer you to some tests, possibly including blood tests to test for thyroid problems or the presence of other substances that may lead to atrial fibrillation, a chest X-ray to see the condition of the lungs and heart, an echocardiogram to diagnose any structural heart issues or blood clots, or an ECG to be able to sense the electrical signals given off by the heart. This can be done with 12 leads in a hospital or clinic, or can be done with a Holter monitor, allowing AF which comes and goes to be detected. Also, some newer smartwatches are now able to sense the electrical signals and can monitor to see if you're in sinus rhythm or atrial fibrillation. But there are ways to control AF. Medications such as beta blockers and antiarrhythmic drugs, an ablation, a cardioversion, or having a pacemaker fitted are all ways in which doctors may treat atrial fibrillation. These methods are discussed further in other videos. Finally, let's take a look at what an ECG trace of AF would look like. The arrhythmia, as discussed earlier, can be identified using an electrocardiogram. The ECG of an AF patient is characterized by disorganized atrial electrical activity and contraction. This can be identified by an irregular rhythm, no visible P waves, the absence of an isoelectric baseline, a variable ventricular rate, QRS complexes usually less than 120 milliseconds, and visible fibrillatory waves may be present. For more information about ECGs, watch our video explaining how they work and the basics of ECG interpretation. Let's just recap what we've learned. Atrial fibrillation is one of the most common heart arrhythmias, and is characterized by disorganized electrical activity in the atria, causing the heart to twitch or fibrillate. It most commonly develops due to age, but there are many other factors that can play a part. And we know ways to diagnose this, such as an ECG or an echo, and we know of the various methods cardiologists can use to treat it. Thank you for watching this video. Please do leave a like and subscribe for more cardiology videos. Join us next time for a look at supraventricular tachycardia. But for now, I will see you all later.